very cooperative in postponing this hearing to try to accommodate our witness who suffered a medical emergency. And while he's still recovering and unable to travel, I'm very pleased to welcome Dr. Elena Craft, who will be providing testimony this morning. There really is no question that reducing ozone levels from 75 parts per billion to 70 parts per billion will have positive human health and economic benefits throughout the country. While the new rule is not as ambiguous as health professionals had hoped for, it will still have, as the health professionals hope, it will still have real and meaningful positive impact on the health of all Americans. Some would likely argue that implementing a lower ozone standard would kill jobs and the economy. We hear it all the time. Some of my colleagues may also suggest that we wait and not, as they say, shift the goalpost with new rules because ozone levels have dropped by 33%. You just saw that chart, since 1980. In short, they will use our current success as an excuse to stop trying to do better. They will also attempt to raise doubts about the scientific evidence justifying the new standard and will exaggerate the cost of its implementation. These kinds of tactics have been used before. Back in the 1960s, the tobacco industry devised a strategy to counter a growing body of scientific and medical evidence that tobacco products unquestionably caused harm. Publicly available tobacco industry documents lay out a detailed strategy that reads in part, doubt is our product since it is the best means by competing with the body of fact that exists in the minds of the general public. It also the means of establishing a controversy. Thus, in any forum they could, tobacco industry scientists attempted to raise doubts about the science, doubts about the scientific models used by government scientists that highlighted the negative health effects of tobacco and secondhand smoke. Tobacco executives also emphasized concerns about the economic impact of proposed regulations on the industry and the economy at large. This strategy served the tobacco industry well, postponing effective action for years, but the American public paid the price in a lower quality of life, increased medical costs, and lost earnings and shortened lives. This same strategy has been mimicked by the oil and gas industry in its attempt to question the scientific evidence pointing to the climate change. Unfortunately, the committee has become a favored forum for rolling out these tactics. We will hear today, for the fourth time in 5 years, from you, Dr. Michael Honeycutt from our home state, from the Office of Environmental Regulations, the Texas Commission of Environmental Quality, TCEQ, which appears to be employing tactics that I've just described. Instead of following the science supporting a reduction in the levels of ozone pollution, TCEQ, along with the industry, has waged a public media campaign, but it's not fooling Dallas, a conservative city, but people in Dallas don't believe you, geared toward raising doubts about the science and alleging dire economic consequences of implementing these new health-based standards. Recent news stories have questioned why the agency spent $2 million hiring a scientific organization that previously did substantive work for the tobacco industry to help TCEQ raise doubts about the EPA's ozone rule. Americans are not fooled by these tactics anymore. Time and time again, the evidence shows that on balance, jobs are created and the economy expands following the passage of major environmental reforms. Stricter pollutions limits force us to innovate and create new technologies. With a fair national regulatory system that protects the public, companies do well by doing good. As it relates to this new ozone rule, EPA estimates the benefits to be more than double the cost That is benefits of $2.9 to $5.9 billion annually compared to the cost of $1.4 billion. Such a return on investment should prove the obvious, that when the environment is healthy, the economy is healthy too. For millions of Americans suffering from respiratory illnesses such as asthma, ozone pollution has a real and destructive effect on them and their families. Hospital records show it and prove it. As someone who worked in the public health field before I entered politics, I'm very sensitive to the impact poor air quality can have on the health of individuals, especially the young, the infirm, and the poor. Unfortunately, those of us from Dallas-Fort Worth region are very familiar with the negative effects of ozone causing smog and are accustomed to seeing health alerts warning us that the air outside is too polluted for us to breathe safely. I am attaching to my statement a report compiled by the minority staff that includes excerpts from some 430,000 written comments on the ozone rule by health professionals and others supportive of EPA's actions to reduce ozone pollution. Mr. Chairman, a strong economy and a healthy environment are not mutually exclusive. We can have both, and we should strive to continue to improve the environment and the air we breathe. I believe EPA's new ozone regulations will help take us to the right direction. Thank you, Mr. Chairman. I yield back.
Thank you, Ms. Johnson. And the gentleman from Oklahoma, Mr. Weidenstein, the chairman of the Environment Subcommittee, is recognized for an opening statement.
Thank you so much, Mr. Chairman. To remind folks, today's hearing focuses on the EPA's final rule announced earlier this month to lower the national ambient air quality standards for ozone to 70 parts per billion, down from the current standard of 75 parts per billion. Nothing in today's hearing is regarding tobacco necessarily, as far as I know. This hearing comes at a critical time as we must carefully review the science, impact, and achievability of this final regulation, a regulation with heavy compliance costs but questionable environmental benefits. Across the country, ozone levels and emissions for volatile organic compounds have been reduced significantly over the past few decades. My home state of Oklahoma is among those constantly working to improve air quality. Despite this, it is concerning that the EPA is proposing to tighten the standard, and I will remind my colleagues that the existing standard, set in 2008, has yet to be fully implemented, and the guidance for state implementation plans was only released this past February by the EPA. States must be given a chance to comply with the existing standard before being imposed another onerous set of standards that are not achievable. This year, this committee has had several hearings to examine this complicated and massive regulation. Here are some of the important facts that we have learned from these hearings. Number one, just one study consisting of 31 participants is being used as the main scientific justification of the costliest regulation in the history of the country, according to Dr. Alan Lafon, a leader in ozone research. Number two, witnesses testified that natural background ozone contributes a significant amount to the observed total ozone concentrations, and with this proposed standard, background or natural ozone may become the main reason areas across the U.S. exceed the standard. Further, there are even many national parks in the West which regularly will exceed the new standard based on natural ozone. Contributions from wildfires to the ozone level are considered a part of background. Tightening the existing ozone standards may cause even more unintentional fires of greater intensity as the use of prescribed controlled fires may be limited. This has serious implications, especially to rural and remote areas. While EPA claims that there are mechanisms to deal with background ozone, EPA has yet to provide details. This is especially true regarding implementation of its exceptional event rule demonstrations. According to testimony of Ms. Kara Kessler from Wyoming's Department of Environmental Quality, quote, Wyoming has submitted 5 stratospheric intrusion demonstrations. They submitted 5. 1 demonstration has been concurred with, and 4 have yet to be even acted on by the EPA. This is an unacceptable track record, and it is imposing costs on people that can't do anything about the background ozone level. Number 5, rural areas will be hit especially hard by the Clean Air Act's transportation conformity requirements, which could mean withholding of federal highway funds if an area is in non-attainment. Again, this is bureaucratic bullying by the federal government against the states, and it needs to stop. According to the Oklahoma Department of Transportation, quote, rural areas do not have the resources to achieve sufficient reductions of pollutants. The proposed action would be detrimental to social and economic development for rural areas across the state of Oklahoma, unquote. Beyond these concerns, it remains troubling to me that those who will bear this regulation's compliance cost may also suffer a decline in their health status. Not surprisingly, the EPA did not include the premature deaths caused by the loss of disposable income when considering the true impact of this standard. Furthermore, millions of senior citizens living on fixed incomes and low-income Americans may be forced to choose between medications, paying for heat, or paying for their food. Moreover, other existing and proposed EPA regulations, such as the proposed Clean Power Plan, will further exacerbate the negative economic impact. This hearing is critical because Congress has the obligation to ensure the EPA adheres to the intent of the Clean Air Act, that the science behind any rule is sound, and that in the totality of the impact of any rule is taken into account. We need to understand the totality of the impact. Before I yield back, I would like to submit a few documents for the record. The first is a group of letters from state and local officials opposing the rule. The next is a map showing that nearly the entire state of Oklahoma, even some of the more rural areas, will be in non-attainment. This would be devastating to my state, which is already working very hard on its own and has been successful, as a matter of fact, to reduce ozone. I want to thank each of the witnesses for coming this morning, and I look forward to hearing their testimony. I yield back the balance of my time, Mr. Chairman.
Thank you, Mr. Bridenstine. And the gentlewoman from Oregon, Ms. Bonamici, the ranking member of the Environment Subcommittee, is recognized for an opening statement.
Thank you very much, Mr. Chairman, and thank you to our witnesses for being here today to discuss the Environmental Protection Agency's final National Ambient Air Quality Standards for ozone. Last week, the EPA took a step in the right direction to maintain clean air and a healthy environment for our country. The new standard of 70 parts per billion is not as ambitious as some might have hoped for, but it will have a real and meaningful effect on the health of all Americans. At a hearing earlier this year on the topic of ozone, one of the witnesses before the committee, Dr. Mary Rice, stated that there is clear, consistent, and conclusive scientific evidence in support of a standard lower than the current level of 75 parts per billion. She also indicated that the scientific evidence available 7 years ago has been supplemented by an even greater understanding of the health effects of ozone exposure. And we must not overlook this point. The Clean Air Act, as passed by Congress, requires that the ozone standard be based on science and health. It prohibits the EPA from considering costs when setting the standard, and it rightfully puts the health and well-being of Americans first. Despite this fact, we will hear today that implementing a lower ozone standard will have devastating consequences to the economy. But has been shown time and time again, the evidence shows that, on balance, jobs are created and the economy expands following the passage of major environmental reforms. Regarding this rule, the EPA estimates the benefits to be more than double the costs. That is, benefits of $2.9 to $5.9 billion annually compared to costs of $1.4 billion. Such a return on investment should prove the obvious, that when the environment is healthy, the economy is healthy. We are already seeing positive results from strong action to protect the air. Since 1980, ozone levels have dropped by 33%. Now is not the time to rest on our accomplishments. The only way to ensure we maintain our progress is to keep moving forward. It's important to point out that the Bush administration ignored the experts on EPA's Clean Air Scientific Advisory Committee in 2008 and implemented a standard they viewed as not sufficiently protective of public health. Thankfully, the Obama administration is basing its decision on the science, not industry interests. Now, let me be clear. In my home state of Oregon, we recognize the challenges associated with implementing a more stringent standard. And I'm glad Mr. Bridenstine raised this point. Wildfires and long-range shifting of ozone from Asia will need to be addressed if we're to achieve a lower standard. That being said, comments the state of Oregon submitted support the EPA's proposal. Specifically, a letter from David Collier, the air quality manager at the Oregon Department of Environmental Quality, on EPA's proposed rule states that Oregon welcomes the EPA's proposal to lower the ozone NAAQS based on advice provided by the Clean Air Scientific Advisory Committee in order to provide the adequate protection to human health and welfare. In its comments to the EPA, Oregon also recommended the development of guidance and tools to address exceptional events like wildfires and the long-range transport of ozone. Thankfully, the EPA is listening to the needs of states and has expressed in the final rule its commitment to addressing the implementation challenges faced by Western states. I want to point out that the EPA has concluded that most U.S. counties will be able to reach the new standard without imposing emission controls beyond those already in place or proposed. Specifically, the EPA has estimated that federal regulations like the fuel economy standards, the Interstate Transport Rule, and the Clean Power Plan will reduce emissions to such a degree that only 14 of the 213 counties expected to exceed the 70 parts per billion are likely to find themselves in non-attainment by 2025. Mr. Chairman, although significant progress has been made in the past 40 years, it is our job and responsibility to build on this legacy and ensure that we continue to improve the quality of our air. A strong economy and a healthy environment are not mutually exclusive. We can have both, and EPA's rule will continue to take us in the right direction. Thank you, Mr. Chairman, and thank you again to our witnesses for being here today, and I yield back the balance of my time.
Thank you, Ms. Motomichi, and let me introduce our witnesses. Our first witness today is Mr. Jeff Holmstead, a partner at Bracewell and Giuliani, LLP. Mr. Holmstead is one of the country's leading air quality lawyers and heads the Environmental Strategies Group at Bracewell and Giuliani. He previously served as the Assistant Administrator at the EPA for the Office of Air and Radiation. He also served on the White House staff as Associate Counsel to former President George H.W. Bush. Mr. Holmstead received his bachelor's degrees in economics and English from Brigham Young University and his law degree from Yale. Our next witness is Mr. Seyed Sadredin, the Executive Director and Air Pollution Control Officer of the San Joaquin Valley Air Pollution Control District. Under his leadership, the district developed a clear mission to improve the valley's health and quality of life through effective and innovative strategies and provide quality customer service to the general public and the regulated community. Mr. Sadredin initiated the implementation of the Technology Advancement Program, which promotes new clean air technology development in the valley. He received his bachelor's degree in mechanical engineering from California State University at Sacramento. Our third witness today is Dr. Elena Craft, health scientist at the Environmental Defense Fund. Dr. Craft has worked on air toxic issues, specifically to reduce criteria and greenhouse gas emission from the energy and transportation sectors. Her efforts have led to the creation of clean truck programs in Houston and other ports around the Southeast. Dr. Craft has been appointed to serve a 2-year term on the Environmental Protection Agency's Science Advisory Board Environmental Justice Technical Review Panel. That's the longest name of any panel I've heard of. Dr. Craft received her bachelor's degree in biology from the University of North Carolina, Chapel Hill, her master's degree in toxicology from North Carolina State University, and her PhD in molecular technology from Duke University. Our final witness is Dr. Michael Honeycutt, the Director of the Toxicology Division of the Texas Commission on Environmental Quality. Dr. Honeycutt has been employed by the TCEQ since 1996 and has managed the division of 14 toxicologists since 2003. His responsibilities include overseeing health effects reviews of air permit applications, the review of the results of ambient air monitoring projects, and the reviews of human health risk assessments for hazardous waste sites. Dr. Honeycutt is an adjunct professor at Texas A&M University, has published numerous articles, and served on numerous external scientific committees. Dr. Honeycutt received his bachelor's degree and PhD in pharmacology and toxicology from the University of Louisiana at Monroe. We recognize and appreciate all of you being here today. Look forward to hearing what you have to say, and Dr. Holmstead will begin with you.
Thank you very much for giving me the chance to testify here this morning. Well, I know other people will talk a fair bit about the controversies regarding the health science and the effects of ozone. What I'd like to do is just put that to one side and say this. Regardless of what you think about that, the way that we deal with ozone today just no longer makes any sense. Ozone is not a new issue. EPA and state agencies have been focused on reducing ozone levels for more than 40 years. As a country, we have spent much more money on ozone than on any other type of pollution, even though all experts believe that other types of pollution pose a greater risk to public health. Now, because of EPA's new ozone standard, we will be forced to spend much more money, tens of billions of dollars, for very small incremental reductions in ozone. This is easy to understand. This is because for almost 40 years, most of the cost-effective, reasonable things that can be done to reduce ozone have already been done. Additional reductions will be much more expensive. Some people think this is okay because the cost is paid by big business, but this is not true. The cost is paid entirely by real people. We all pay the cost in the form of higher prices, smaller retirement accounts, and lower levels of economic growth. This is why we should all care about the cost of regulations as well as the benefits. I would like to highlight just two issues. First, the new ozone standard will effectively ban new industrial development in many parts of the country. In many areas, it will be impossible to build or expand an industrial facility, even though it would be built with state-of-the-art emission controls and even though the local community might desperately want the jobs it would bring. Here is why. Anyone who wants to build or expand an industrial facility must first obtain a Clean Air Act permit. In some areas, you can't get such a permit unless you can first show that emissions from the new facility will not, quote, cause or contribute to a violation of the new ozone standard. But this will not be possible in areas that met the old standard but do not meet the new one. You can't show that a new facility will not contribute to a violation of the new standard because the area, according to EPA, is now in violation. And if you can't make this showing, you can't build a new plant, no matter how clean it is. EPA says that you might be able to get around this problem by paying another facility in the area to reduce its emissions, enough to offset emissions from the new plant. This is called getting offsets. But in many cases, this will not be possible either. Many areas that exceed the new standard are rural areas where there is little or no industry. They exceed the standard not because of local emissions, but because of background ozone and emissions in other areas. In these cases, there is no offsets to be purchased, so no new plants can be built. A related problem will occur in areas that don't meet the previous standard. To build a plant in these areas, a company has no choice but to purchase offsets. In fact, it must obtain offsets that are between 10 and 50% greater than the emissions from the new facility. Now, please note that offsets cannot be created by emission reductions that are required by EPA or state regulations, only by reductions that go beyond what is required. But remember, for more than 40 years, EPA and states have been looking for every conceivable way to reduce ozone. Where there are any additional reductions to be had, they are very expensive. For example, in the Houston area, where there is so much industry, it is possible to purchase offsets, but they are enormously expensive, as much as $300,000 a ton. Even a relatively small facility with state-of-the-art pollution controls would need to spend tens of millions of dollars just to purchase enough offsets to get a permit. I will summarize the second issue very briefly. The Clean Air Act program for dealing with ozone was established in 1970 when Congress believed that air pollution was primarily a local problem and that states could solve it by regulating local industry. We now know differently. Ozone is a global issue. When there are high ozone levels, they are largely caused by things outside of a state's control, by cars and trucks, which are regulated by EPA, by natural background, and by emissions from other states and other countries. The state only has control over emissions from its own industrial facilities, but under the Clean Air Act, it has the sole legal obligation to meet the new standard. In a number of states, however, a state could shut down all the industrial facilities in the whole state and still not meet the standard. Because 70 parts per billion is so close to background ozone levels in some areas, there is simply nothing a state can do to meet the new standard. As a result, the Clean Air Act now appears to give a rather remarkable authority to EPA, the authority to impose a legal obligation that is impossible to meet. To me, this seems contrary to our long-standing notions about the rule of law and the way the federal government should operate. Thank you.
Thank you, Mr. Holmstead. Mr. Sadredin,
Good morning, Ranking Member Smith.
make sure your microphone is on. Push.
Good morning, Chairman Smith, Ranking Member Bonamici, members of the committee. Good morning. It's a great honor and a pleasure to be here before you today. Thank you for the invitation. I come from the beautiful and bountiful Central Valley of California, San Joaquin Valley. Over the last 3 decades, we've done quite a bit of work to improve quality of life and reduce air pollution in San Joaquin Valley. I'm not here today to urge your committee to curb EPA's authority to set new standards, or ask you to even ignore that.
Yeah, ignore those bells. Yeah.
Or ask you to roll back any of the health protective safeguards in the Clean Air Act that have really brought us to where we are today. At the outset, I want to say that the Clean Air Act over the last 40 years has resulted in a great deal of reduction in air pollution, improved public health and quality of life in many regions, including our region. What I'm hoping to do, though, is to give you a preview of what might soon be coming to your neighborhood with the new standard that EPA just published, because we have been at the forefront of what we have to do, even with the old standards that EPA published, because of our geography, topography. The problems that we have faced over the last 2-3 decades are going to be exactly the problems that you might face in your neighborhood soon with the new standard. And I'm here really today to ask the Congress to provide some guidance to EPA. We believe the world is a different world today compared to 25 years ago, when the Congress last amended the Act, or 40 years ago when the Congress passed the Act unanimously, virtually unanimously. There was only a handful of no votes. I think if the Congress understood at the time that you would face a circumstance like we do today, that after having reduced air pollution by over 80% in our region, having imposed the toughest regulations on every sector of your economy, from a small mom and pop operations, dry cleaners, paint shops, all the way to your largest power plants and refineries, that you would still face a major gap that would dictate a tremendous penalty on the residents of your region, the businesses that operate in your area. I don't think the bill would have passed unanimously, let alone even if it would pass at all. So I just wanted to share with you some of our experiences and really what we're asking the Congress to do in the form of a fine-tuning of the Act, as we call it. It's our 2015 Clean Air Act modernization that has 5 specific proposals in it. The first proposal that we have in our legislative initiative that we are taking is to eliminate duplicative requirements, confusion, and costly bureaucratic red tape that is currently happens with our chaotic establishment of the new standards, by synchronizing the new standards. When EPA publishes the new standards, let's synchronize the old standards without any rollback. Let's have a unique set of requirements that we have to follow instead of having multiple plans in place. In our region, for instance, right now we have 6 attainment plans in place, with 4 more attainment plans being due in the next 4 years, all with redundant duplicative requirements that we have to deal with. The other change that we're asking, and I agree with what the ranking member said, that good economy and good environment, good public health are not mutually exclusive. In fact, we believe you do need a vibrant economy to have the wherewithal to do all the difficult things that we need to do to improve our air quality. And so in our proposal, we're asking that instead of the formula-based deadlines that the Congress set 25 years ago, to take into account the economic feasibility and technological achievability and set in deadlines. Give us time to get to these tough standards. Don't set impossible deadlines that are not that we're not able to meet. Banning fossil fuel combustion, which is really what it takes for us to meet the new standard, is not doable simply in 20 years. We need more time to be able to develop the technology and the infrastructure to do that. We also ask that the Act be amended to really treat different pollutants differently. Not all pollutants are created equally. When the Congress passed the Act some 25 years ago, with the latest amendments, they thought it was all about VOCs, volatile organic compounds. We are finding today that science dictates that different pollutants have different impacts on air quality, and we need to be able to have a system that allows us to have a appropriate weighing of those pollutants and deal with them. With respect to extreme non-attainment areas such as we are, and I'm almost finished, we ask that we remove the requirement for having contingency measures. It is one of those well-intended provisions in the Act that are leading to unintended consequences, and I'd be happy to give you more details on that. And we also ask that for regions such as California, where we have done many things to reduce pollution from mobile sources early on, give us the ability to be able to take credit for those as opposed to taking those credits away in the way that some of the court rulings are being interpreted by EPA. And I have details about all of these in my presentation, and would be happy to answer any questions you might have.
Thank you, Mr. Sadredin. And Dr. Craft.
Thank you, Chairman Smith, Ms. Bonamici, members of the committee, for the opportunity to testify here today about EPA's revision to the nation's health-based ambient air quality standard for ground-level ozone. My name is Elena Craft. I serve as a senior scientist at Environmental Defense Fund, a national nonpartisan science-based environmental organization where I manage a team working to identify strategies and opportunities to reduce harmful air pollution, such as ozone, from pollution hotspots. EDF has over 1 million members. Our organization links science, economics, law, and private sector partnerships to solve our most serious environmental challenges. In addition, I have an adjunct appointment at the University of Texas Health Sciences Center in Houston, and as I was 7 months pregnant the last time I testified in front of this committee, I'm also the mom of a very busy toddler. The Clean Air Act is a bedrock public health statute representing the best of a bipartisan America, encompassing the values of environmental protection and healthy air that we espouse as a nation. The unanimous vision forged into law by the U.S. Senate has secured healthier air for millions of Americans, netting benefits valued at over $21 trillion between 1970 and 1990. Indeed, by 2020, EPA estimates the 1990 Clean Air Act amendments will prevent a projected 230,000 deaths, 2.4 million asthma attacks, 200,000 heart attacks, and 5.4 million lost school days. EPA also found that these vital health protections would provide $2 trillion in monetized benefits. Additionally, EPA projects a net overall improvement in economic growth due to the benefits of cleaner air. The Clean Air Act is sharply focused on ensuring the nation's health standards that are established solely on the basis of public health. On October 1, EPA established a revised ozone standard of 70 parts per billion, improving America's national air quality standard for ground-level ozone. Why? Because scientific evidence overwhelmingly demonstrates that the previous 75 part per billion standard is not requisite to protect human health with an adequate margin of safety as required by the Clean Air Act. The recommendations of the statutorily established and independent Clean Air Scientific Advisory Committee underscore the need, as determined by the latest scientific evidence, to strengthen the ground-level ozone standard. CASAC found clear scientific support for the need to revise the standard. While recommending a range of 60 to 70 part per billion, the committee went on to emphasize the inadequacy of a standard at the upper end of the range. At 70 part per billion, there is substantial scientific evidence of adverse effects, including decrease in lung function, increase in respiratory symptoms, and increase in airway inflammation. And CASAC is not alone in concluding that the 2008 ozone standard was inadequate. the American Thoracic Society, the American Academy of Pediatrics, the American Medical Association, the American Heart Association, the American Lung Association, American Public Health Association, Children's Environmental Health Network are just a few of the medical and public health organizations that have supported strengthening the standards. Some claim that adopting strong ozone standards will cause economic harm. Unfortunately, these sky-is-falling prognostications are not new. The fact is that we can do it, and we have done it. Since 1970, our nation has reduced the 6 pollutants regulated under the National Ambient Air Quality Standards Program by almost 70%, while GDP has grown by nearly 240%. And currently, 90% of areas designated for the 1997 ozone health standards now meet those standards. Regions are not alone in meeting the new health-based standards. America has already taken steps over the past few years that will help reduce ozone smog pollution and help restore healthy air in a cost-effective manner. Some of these protections include the Tier 3 tailpipe standards, recently finalized greenhouse gas and fuel standards for medium and heavy-duty trucks, and EPA's Clean Power Plan. The Clean Air Act is a vibrant, bipartisan, made-in-America law that has stood the test of time, delivering a stronger, healthier, and more prosperous nation. Let's build on this legacy of bipartisan collaboration and follow the time-tested, common-sense path forward in protecting the health of our children and our communities. Thank you very much.
Thank you, Dr. Craft and Dr. Honeycutt.
Good morning, Mr. Chairman and members of the committee. I'm Dr. Michael Honeycutt, Director of the Toxicology Division at the TCEQ. I lead a division of 14 toxicologists who are responsible for evaluating a broad spectrum of environmental quality issues, including deriving acceptable levels of air contaminants. The TCEQ has derived acceptable air contaminant levels for many thousands of air contaminants over the last 30-plus years, and our current team of toxicology risk assessors has over 280 combined years of experience in these fields. We derive these levels using a scientific, peer-reviewed method, and many of these levels and their derivation process have been published in independent scientific journals. Other state governments, federal agencies, including the EPA, and other countries use the TCEQ's acceptable air contaminant values. On October 1 of this year, the EPA decreased the level of the ozone standard from an annual fourth highest daily maximum 8-hour concentration of 75 parts per billion to 70 parts per billion. Today I will address considerations of overall health risk, but first I'd like to set the record straight on the ozone science. Based on our extensive background in deriving acceptable air contaminant levels, we independently reviewed thousands of studies on ozone, including the studies EPA reviewed as part of setting the final standard. Ozone is a simple oxidizing chemical that, at high enough concentrations, can cause inflammation in the lungs, and it can reversibly limit the body's ability to inhale and exhale a normal volume of air. However, there remains large uncertainty and variability in the scientific literature. With regard to changes in lung function and asthma exacerbations, 8 out of 9 studies investigating lung function changes caused by ozone showed no difference between asthmatics and healthy individuals. As we stated in our comments to EPA, the dose that a person would be expected to receive at 75 parts per billion is almost no different than at 70 parts per billion or even 65 parts per billion. And you can see figure 1 in my comments to see that. Consistent with this finding, the EPA does not predict, let me say that again, the EPA does not predict that a decrease in the ozone standard will cause a statistically significant decrease in asthma attacks. You can see figure 2 for that information. The basis for setting the standard at 70 parts per billion was to make it lower than the lowest concentration where adverse effects were observed in human-controlled exposure studies, which was 72 parts per billion. However, in order to observe any effects at this low ozone concentration, the authors had to expose the human subjects to ozone while they were exercising at moderate to heavy exertion for 50 minutes out of every hour for 6.6 hours. This is an unrealistic exposure scenario for the general public, much less for sensitive groups. Therefore, it would take a higher exposure concentrations to have the same effect noted in that study. Although asthma exacerbations and changes in lung function are the most important and biologically relevant effects, most of the monetary benefits that EPA ascribes to reductions in ozone are from the reductions in premature mortality. They do this despite the fact that, from a toxicology standpoint, there is no explanation for how 8 hours of ozone exposure at ambient present-day concentrations on one day can cause premature mortality the next day. In addition, the EPA administrator has expressed a lack of confidence in these studies associating ozone with premature mortality due to the inherent study uncertainties. The results from these studies are also contradictory and inconsistent. For example, in the main mortality study the EPA uses, Smith, 2009, showed that only 7 out of 98 U.S. cities have a significant associations between 8-hour ozone concentrations and mortality. Also, astonishingly, the EPA's analysis shows that mortality increasing in certain cities, including Detroit and Houston, when decreasing the ozone standard from 75 to 70 parts per billion. And no, I did not misread that. Some inconsistency between study findings is not uncommon. Scientists who are experienced in risk assessment can incorporate these disparate pieces of information into a cohesive characterization of health risk. The EPA would be better advised and critiqued on their risk assessment if a risk assessor was included on the Case Act. A chemical risk assessor is essential to put the potential risk highlighted by the other Case Act experts into context with the inherent background risk present in our daily lives. The Clean Air Act does not require that risks are reduced to zero, and risk assessment with uncertainty analysis can demonstrate the reduction in risk or lack thereof from a reduction in a regulatory standard. The lack of consideration of overall risk is perhaps most apparent when reviewing the revisions to the EPA's Air Quality Index in the final rule. According to the new category breakpoints, sensitive members of the public will now be cautioned to consider reducing prolonged or heavy outdoor exertion at 55 parts per billion ozone, a number that has no experimental basis. Beginning at 71 parts per billion, the EPA advises the public to keep their asthma inhalers handy. Anecdotally, we are told that some schools in Texas will cancel recess when they receive this alert. The problem is that this is based on a single study that showed a mild lung function effect after exposure to 72 parts per billion for 6.6 hours with vigorous exercise. And it is to be used to cancel a 20-minute recess. In the Dallas-Fort Worth area of Texas in 2014, there would have been 23 such days that children might not have been able to play outdoors. These health messages and the new frequency with which they will be released can lead to growing public concern over air quality that is actually getting better, and can lead to keeping our children and ourselves from well-documented physical and psychological benefits of outdoor exercise. Let me be clear. Under certain circumstances, at high concentrations, ground-level ozone can have negative implications for respiratory health. But our investigations conclude that low concentrations that we see today, the risks to respiratory health are small and are not significantly diminished by the decreasing ozone standard. I have a tremendous amount of respect for the intent of the Clean Air Act and the EPA and the role that science plays in setting meaningful policy. I thank you for the opportunity to be here, and I'm happy to answer any questions.
Thank you, Dr. Honeycutt. I'll recognize myself for questions, and Mr. Holmstead would like to direct the first one to you. And that is, you've mentioned several examples, but would you just summarize the adverse consequences of this new ozone regulation?
Well, the most immediate one is really that it will ban industrial growth in many parts of the country. That's not universally true, but there will be many parts of the country where no matter how hard a local community wants to attract a new industry, it won't be able to do so because they can't get the permits they need to build or expand a new industrial facility. The longer-term consequence is that it really does drive up the costs of virtually everything we consume, not only energy, but other products as well.
Okay, thank you, Mr. Holmstead. Mr. Sadredin, you mentioned the San Joaquin Valley. Does the technology exist today to actually enable that region to attain the standards that it needs to attain under the proposed rule?
Simple answer is no, but that is not limited to the newest standard alone. As we speak, EPA has already classified San Joaquin Valley as extreme non-attainment, even for the 75 parts per billion standard and the previous standard of 84 parts per billion. And extreme by definition means that technology today does not exist.
Any idea when the technology might exist, or is it just totally unknown?
At this point, it's unknown. EPA, in their own latest regulatory impact analysis, they talk about technology that does not exist, and they don't know when it would be available. And that is why we are urging the Congress to take that into account, make some fine-tuning of the Clean Air Act to allow that to be considered in setting up the deadlines and what it takes, how long it takes to come into attainment.
I know you're considering this, but I think you'll find the courts on your side, and it's going, if the EPA if you can't comply because the technology is not available, you can't be held accountable. So I hope you succeed in that regard.
Thank you.
Dr. Honeycutt, would you spend a little time explaining to us the single study that the entire ozone regulation relies upon, and why there are limitations to the science that were relied upon in that study? First of all, I can't believe we're just relying upon one study. That clearly smacks of cherry picking, but if you'll go into some detail about the flaws in the one study and why only one study was used.
Sure. It is based on, or the level of the standard is based on one study, the Schlegel 2009 study, where 31 people were exposed to ozone at various levels for 6.6 hours, exercising moderately to vigorously for 50 minutes out of every hour during that 6.6 hours. And at the 72 part per billion exposure concentration, 6 of the 31 people had lung function decrements greater than 10%, which EPA considers adverse. The problem is the group mean was only 5.5%, a little over 5%. And the group mean wasn't adverse, but what EPA did was pick out the 6 that were. So they cherry-picked those 6 people out of the group, and you're not supposed to do that. That's not scientific. That's why the study authors didn't publish the journal article that way, because it wouldn't have been published, because nobody would accept that. So that's what it's based on.
If any other organization relied upon a single study involving 6 out of 31 people, it would be laughable. And the fact that the EPA is going to subject millions of people to an unworkable standard at great cost because of that one flawed study is just amazing. And so I agree with your conclusion. That also concludes my comments, and we'll go now to the gentleman from Virginia. Do you want to recognize somebody else first? Okay, Mr. Byer is recognized for his questions.
Thank you, Mr. Chairman, and thank all of you very much for being here. I'm actually pleased to be part of this morning, just thinking how far we've come, that we have 4 witnesses representing both people for and against the ozone rule who are here testifying that clean air is a good thing and that we've come a long way, and all committed to making it better, and that the debate's about the level that we set and the costs and benefits, and that, for me, the factor of this debate is progress, so thank you. Mr. Chairman, we have a witness from California here today, and California really has some unique, okay, I don't need to do this for the record, so never mind, I'm going to go on. Thank you. Also for the record, yeah, I'm a businessman, family business. We have our 42nd anniversary tomorrow in retail automobile sales and service. And so for 42 years, I've been hearing about the devastating consequences of new regulations. I just want to say that that's nuts. I remember 1982, Ronald Reagan's Federal Trade Commission was coming out with the used car disclaimer on the windows. And everywhere in America, all the things were, this was going to be the end of the free market, the end of automobile sales. We adapted to it in about a week. In 2009, CAFE standards had been set at 22 miles per gallon from 92 through 2008. The President Obama raised it to 35 by 2016. Again, devastating consequences. We were told the technology does not exist. Well, it's almost 2016. We'll be at 35 miles per gallon. We're about to sell 17 million new cars in America this year, and manufacturers and dealers are having all-time profit years. If anything has pulled down profits, it's been the internet and the commoditization of our products. So, Dr. Craft, we just heard that Dr. Honeycutt say that all this is based on this one study, 6 out of 35 people. It's my understanding, though, that before the Schlegel study was done, in the George W. Bush administration, his EPA's Clean Air Scientific Advisory Committee Ozone Review Panel wanted it to be set between 60 and 70 parts, and that unanimously recommended that. And we're disappointed when the president, recognizing business pressure, put it at 75. How do you respond to that? And is this really based on one study and 6 people?
Thank you. No, it's not. We have sound evidence of the health effects of ozone from 3 branches of science: controlled human exposures, community health studies, and toxicology studies. EPA reviewed thousands and thousands of papers. They have summarized their scientific findings in the Integrated Scientific Assessment, which was under review by 3 different science advisory committees. They have published those findings. The public was able to participate in looking at the review that EPA scientists had done. And just a couple of examples from the summary, from EPA's summary. They looked at respiratory effects, causal relationship between short-term ozone exposure and respiratory health effects. They have looked at cardiovascular effect, likely to be causal relationship for short-term exposures to ozone and cardiovascular effects. Central nervous system effects, suggestive of a causal relationship between ozone exposure and CNS effects. Total mortality, likely to be a causal relationship between short-term exposures to ozone and total mortality. These are not summaries that were derived from a study that picked out 6 people. I guess I wanted to also mention that while the administrator noted the study in her announcement of the standard, there are other studies that have shown that there is a significant effect below 72. It's the Kim study from 2011. So, the idea that we're relying on just one study is not accurate, and it has been a process where EPA has included the public and has been very transparent in this process.
Great. I'd also like to point out quickly that in the pharmaceuticals, they'll spend hundreds of millions of dollars testing new drugs. And if they get 1 or 2 or 3 adverse effects out of 100,000, they'll take the drug off the market. So 6 out of 35 actually seems like an awful lot to me. Dr. Pete at Johns Hopkins had a paper that has been misinterpreted to say that poverty makes asthma work rather than ozone. Can you respond to this mischaracterization of Dr. Keate's letter? And I'd like to enter her response for the record, please, without objection.
Without objection.
Sure. That paper, I think, was misunderstood. The study did not actually look at air pollution at all. So any characterization that air pollution is caused by poverty was not the subject of the study itself. And I think that's what Dr. Keate has sent and submitted as part of her letter.
Thank you, Mr. Beyer. The gentleman from California, Mr. Rohrabacher, is recognized.
So we have one person telling us that this is all based on one study, and we have another witness telling us that there are thousands of studies that indicate this. Could you name a few studies, Ms. Craft, about that have actually been accepted by the EPA administrator as being legitimate studies that went into this decision?
In the integrated science assessment that EPA derived, they include all of the studies that they had looked at.
Could you name me a couple of the studies that it is my understanding that the EPA administrator has said that there are thousands of studies that have happened on this, but none that can be trusted. Maybe you could name us 2 or 3 other studies that have been trusted that would be accepted by the EPA administrator on this.
Yeah, I guess I'm not sure what you mean by trusted. I mean, the EPA looked at all of the available studies. So, for example, Jarrett et al., 2009.
Okay, so you're saying, say it again now, you're giving us a specific now, because I'm going to want your, Dr. Honeycutt's response to this. So there was what study you're talking about now, specifically?
Well, I guess is the question, what are some of the studies that EPA examined as part of their integrated science assessment?
No. Which ones were accepted by the EPA administrator as being specific to this decision? It says we're being told by Mr. Honeycutt that that there's only one study, and that we're naming it now, that specifically justified these EPA rules. You're telling us that the EPA used as an example of this is why we're putting this new rule out, and you're saying that there are thousands of other studies. Could you name us several that the EPA has cited as reasons for their decision?
I guess the question is about EPA relying on only one study. And I guess my opinion is that that is a mischaracterization, and I'm not sure where that is characterized.
Well, maybe you can tell us the name of 3 or 4 studies then. You're saying there are thousands of them that the EPA has used to justify this change.
They've looked at
I'm not
a
saying,
lot of
no, no.
studies.
What have they said? This is what justifies our change. Not that here's an amorphous over here. We've looked at thousands of things for and against, because for all we know, maybe half of them they believe were against what they have decided on. What 2 or 3 studies? This guy's saying that there's only one. You're saying there are thousands. Give us 2 or 3 studies that the EPA has used to back up this change in regulation.
The Jarrett et al. 2009 study, the Kim et al. 2011 study, the Steelan study.
Okay,
I
now
mean,
we
I
have.
can name
now-
a
now
lot
this-
of ozone
Okay, you've just
studies.
named 3, is that
Right.
correct? Okay, now, go for it. Mr. Honeycutt, why, you said there's only one.
Actually, the Kim study did not find effects. Well, it found significant decrease in FEV1, a 1.8% decrease at 60 parts per billion, but by nobody's definition is that an adverse effect. Not the American Thoracic Association Societies, not by EPA's, by nobody's.
Okay,
It's
so
just
you're just saying that there has only been one study that shows
The Schlegel
an
study.
actual detrimental impact, but
Well, it depends on your definition. Okay, by EPA's definition, it's not unless you pick out the 6 people. So
so is
the previous standard was set based on epidemiology data. This one, they switched it and based it on the clinical data.
Okay.
And KSAC spent a whole day talking about this one study, where they should set this, how the phraseology they should use.
But I want to get back to the one that we've just given an example, and you say that one did not,
Jarrett 2009.
and that did not justify.
That is the only long-term study out of 12 that found associations with ozone.
Oh, no, yeah, but we just had, what was the other? I'm sorry, I'm new to this. I'm a novice on these specific studies now.
I actually have the
two
studies
experts.
right here. I can share them with you.
So you have, Dr. Craft, you have the specific study, you just mentioned 3 studies, is that correct? To us.
Yeah, I mentioned 3, yes.
Okay, and you're saying those 3 do not indicate that, and have not been, meet the EPA's justification for these.
Well, there's different
standard
things.
change.
Okay, there's the single study in which they used to say 72 is the number.
Yeah.
Okay, and then they said, well, all these other thousands of study support that.
Okay,
But there is one study that EPA says, okay, this is the reason we're going to set it at 72. And KSAC spent a whole day talking about that one study. I watched it.
but the other studies do indicate that,
The Kim study doesn't.
does not. Okay, you're saying that this study does, and you're saying,
And actually, the Jarrett study does not either.
but please go right.
Well,
The
I guess
gen-
I
the-
just wanted to mention that these studies were done in perfectly healthy individuals. So the fact is that the Clean Air Act requires that you set a standard that's requisite with an adequate margin of safety. And so that is one of the issues. So maybe a 1.8% decrement in lung function in a perfectly healthy person is not considered an adverse health effect. But if someone has asthma or COPD, then in fact it is.
But
So-
that's your opinion and not EPA's.
Gentleman's time has expired. Thank you, Mr. Rohrabacher.
Thank you.
And the gentlewoman from Oregon, Ms. Bonamici, is recognized.
Thank you very much, Mr. Chairman. I want to start by aligning myself with Mr. Byers' comments. I think we can all agree that our constituents, our children, our families expect and deserve to live in an environment where the air they breathe and the water they drink is healthy. So start with that premise. Also, I want to talk a little bit about how there's been a conversation about the costs and technological challenges associated with implementing the new ozone standard. And we've had this conversation many times in the committee that oftentimes the regulation drives innovation and technology. We're a very innovative country, and certainly when there's a requirement, our companies step up and develop new technologies. I have confidence in that. I want to talk, Dr. Craft, we had this conversation in your testimony and my statement about how the Clean Air Act does not permit the EPA to consider the costs or the attainability of technological feasibility. They determine the standard based on public health concerns. So I want you to comment on why that's important, but then I also want you to expand a bit, please, on your comments in your testimony about the prevention of premature death, asthma attacks, and more. Can you talk about the costs saved under the lower standard, costs like healthcare costs and lost productivity?
Thank you. Congress intentionally set the Clean Air Act to specifically not consider costs. And I think the reason that they did that is because they wanted the integrity of the science to be maintained. The science is a separate and distinct issue from costs or implementation. And the primary goal of the standard is that it will protect the health of the population with an adequate margin of safety. I think in past history, cost estimates have been overblown and overestimated. If you were to let costs be considered as you evaluate the science, you may come to different conclusions that would be unduly influenced by cost estimates. I think that's why Congress is so explicit on this point. And just as a note on the devastation to the economy, I'd like to read a section from a report from the Texas Commission on Environmental Quality. In 2009, the Houston region reached attainment with the 1997 ozone NAAQS. According to an economic analysis completed by the TCEQ, the Houston area exhibited the highest economic activity of any 3-year period on record during the 2007 through 2009 time period. The analysis further describes that over the last 2 decades, ozone concentrations and economic growth have rarely been correlated in the Houston area, and that many of the years that saw robust economic growth coincided with declines in the 8-hour and 1-hour ozone design values. According to TCEQ's analysis, quote, reducing ozone concentrations in the presence of continuing economic growth through the development of state implementation plans and implementing control strategies for emission reduction is possible. Expansion of emitting activities during phases of economic growth certainly makes the task of attaining clean air standards more challenging, but it should not prevent and has not prevented the HGB area, among many others, from making substantial progress in improving air quality.
Thank you, Doctor. I want to get one more question, and my time's about to expire. I would like you to comment, please, on the issue that I mentioned about, like in my home state of Oregon, they have a concern about the background and the long-range transport of ozone or precursors. I know that the Act allows for these exceptional event exceptions when there's something like a wildfire or transport of air pollution from overseas. So can you please talk about what recommendations you might have for the EPA as they begin revising the exceptional event rule?
Sure. First of all, instances of elevated background ozone in western states are actually infrequent and have been shown to rarely contribute to exceedances in the NAAQS. Even where background ozone levels can reach a considerable fraction of seasonal mean ozone levels, anthropogenic emission sources are the dominant contributor to the most modeled ozone exceedances of the proposed NAAQS. And then days when ozone levels are elevated do not have higher levels of background ozone. And then just recently, Janet McCabe, Acting Assistant Administrator, Office of Air and Radiation, issued some guidance. Under the Clean Air Act, states are not responsible for reducing emissions from background sources. We intend to work directly with responsible air management agencies in these areas to ensure that all Clean Air Act provisions that would provide regulatory relief associated with background ozone are recognized, and they're currently developing those revisions to the exceptional events rule. And I think the process there is that they want to streamline the procedures that these state environmental agencies have to go through to have approval of the exceptional events.
Thank you, Dr. Craft. My time has expired. I yield back. Thank you, Mr. Chairman.
Thank the gentlewoman for yielding back. The chairman has stepped out, and I'm pleased to sit in. And I've got a few questions now, if I might. And I'm going to start by submitting 2 items for the record. The first is a map that shows the attainment areas in, or the non-attainment areas in Ohio, areas that would violate the 70 parts per billion standard. And the second item is a letter by Ohio's Lieutenant Governor, Mary Taylor, to EPA Administrator McCarthy. And this letter is from March 2015, in which the Lieutenant Governor expresses serious concerns with the proposed rule to change the National Ambient Air Quality Standard for ground level ozone from 75 parts per billion to a standard in the range of 65 to 70 parts per billion, and ask that the EPA administrator reconsider these burdensome regulations. And as we all know, the EPA has moved forward with their proposal to lower the standard to 70 parts per billion. So, Mr. Holmstead and Mr. Sadredin, how do these stringent ozone standards and regulations discourage economic development? Mr. Holmstead, you can go first.
Well, as I've tried to say, I think the biggest issue in the near term is that it just stops people from building new industrial facilities. And the thing that's especially pernicious about this standard is that it will bring all these rural areas into non-attainment. And the way the Act works, and this is one of the things I just don't think makes any sense, is if you want to build a plant in this rural area where there's no other pollution sources, you can't do it, because the only way you can build that plant is if you pay someone else in that area to reduce their emissions. And so you have these communities that would like to have state-of-the-art, best-controlled plants in their communities to provide jobs and economic opportunity, but you can't do it because the Clean Air Act prevents it because of this new standard.
Mr. Sadredin.
Yes, Mr. Chairman. Every time you establish a standard, it essentially establishes a tolerance limit for your region for pollution, above which you simply will be in violation of the standard and the Clean Air Act regulations, which then kicks in very expensive sanctions. In our region, in San Joaquin Valley in California, the background ozone concentration is about 50 to 60 parts per billion. And that is not, on days when Dr. Elena mentioned that, you should not be worried about attainment because those are not the days you violate the standard. We're talking about ground level ozone concentrations on the days when our region exceeds the standard. Just simply the background ozone concentration is about 50 to 60. So when you have that and then you look at the standard of 70 parts per billion, you only have that 10 parts per billion margin that can be tolerated by man-made local air pollution, which means essentially in your area you have no tolerance for growth. You cannot let new businesses coming in In addition, you have to go after existing businesses to reduce air pollution.
If
which
that's
is-
the case, if that's the case where you've got that 10 parts per billion margin, if that's going to stymie growth, is it accurate to say then, is it safe to say that those areas that are in non-attainment, there is no growth? I mean, they are squelched in terms of being able to grow economically.
Right, the act as it's written right now, it requires that if you're in attainment right now, let's say with the existing standard, before you can permit a new facility, you have to make a finding, scientific finding, that the new facility will not cause a violation or contribute to violating a new standard. In this case, with that 10 parts per billion margin of error, that's a very tight standard that is quite difficult to meet, and then you need offsets, as Mr. Holmstead mentioned. You don't have credits to be able to bring in facilities in. So it makes it very costly. In California, we're essentially at the position that businesses do not locate in California unless they have to.
Okay. Let me, one of the things that has really spurred America's economic energy boom here over the last few years has been the shale play in eastern and southeastern Ohio. Do you think these more stringent ozone standards undermine the benefits that we've seen in the energy revolution, the energy boom with oil and gas?
Well, for our region, and California in particular, even Southern California, to be able to meet the new standard, we have to ban fossil fuel combustion emissions. That has to happen either through totally eliminating fossil fuel combustion, and I'm not only talking about mobile sources, cars and trucks, we're talking about industrial facilities no longer being able to use natural gas, any kind of fuel in their...
In an area like eastern and southeastern Ohio, where we still get over 60% of our energy from coal, that's a heavy lift for us. My time has expired. I'd like to now go to our colleague, our gentlewoman from Massachusetts, Ms. Clark.
Thank you, Mr. Chairman, and thank you to all the panelists for being here today. Mr. Chairman, I have a letter supporting the lower ozone standard from locally elected officials from across the country, including Mayor Rob Dolan from my hometown of Melrose. And in that letter, they state, the current George W. Bush era standard of 75 parts per billion has been widely acknowledged by the medical community as insufficient to protect public health. As mayors, we are on the front lines of protecting the safety and well-being of our constituents, and this long overdue update will reap tremendous benefits for our communities. I ask that this letter be submitted for the record. And I would also like to refer to another letter that I will ask also be submitted for the record. And this is a letter I would like to ask Dr. Craft about. It's dated April 7th, 2008. And this is under the Bush administration. This is from the members of CASAC, the Clean Air Scientific Advisory Committee. And in this letter, 18 members of that committee, those scientists, unanimously wrote that they recommend decreasing the primary standard within the range of 60 to 70 parts per billion. It is the committee's consensus scientific opinion that the decision to set the primary ozone standard above this range fails to satisfy the explicit stipulations of the Clean Air Act, that you ensure an adequate margin of safety for all individuals, including sensitive populations. Dr. Craft, could you comment on the difference between what we're hearing today, that this is based on something new and perhaps one study, and this letter of April 7th, 2008, where we had 18 members unanimously recommending an even lower standard than the one we're looking at implementing?
Yes, thank you. There is strong scientific consensus that the ozone standard must be significantly strengthened. Since the last review, scientific evidence has only grown on the many health risks associated with ozone. It's documented in EPA's Integrated Science Assessment. The assessment is the result of a rigorous, multi-year expert review process with several public hearings and comment, and it concluded that ozone harms lung health, including causing asthma attacks and increasing the risk of hospital and emergency room visits. It also concluded that ozone likely caused premature deaths and identified new threats, providing strong evidence linking ozone to cardiovascular harm and low birth weight in newborns. There have been multiple doctors that have testified in some of these hearings. I'd like to just point out some that were given by Dr. Greg Wallenius. He presented to the Senate Environment and Public Works Committee in December. In his testimony, he noted the physiologic mechanisms occurring with ozone exposure, activation of neural reflexes, initiation of inflammation, sensitization of bronchial smooth muscle, changes in immunity, and airway remodeling as some of the underlying physiological mechanisms associated with ozone concentrations below the current standard that contribute to those increased hospital visits, those increased asthma attacks, and those days of missed work and missed school.
Dr. Craft, in the letter from the mayors from across the country, they estimate that taxpayers would save as much as $75.9 billion through lower health care costs. Is this in line with the numbers that you've seen?
Yes, it is, and I'd like to point out that 6 of the top 10 fastest growing cities in the country are in Texas and California. So the idea that we're trampling economic growth because of an onerous ozone standard is not held up in the economic development that's been reported.
And going back for a second to the April 2008 letter, it's my understanding that this was this unanimous recommendation of 60 to 70 parts per billion was based on almost 1,300 scientific studies at that time in 2008. Is that correct?
Yes, that's correct.
Thank you. I yield back.
Thank the gentlewoman for yielding back. We now go to, I recognize our colleague, Mr. Bridenstine from Oklahoma.
Thank you, Mr. Chairman. So it's really difficult, if not impossible, to prove a counterfactual, which means if the economy in Texas is growing, there's a whole host of reasons that could be, and more regulations does not grow the economy in Texas. Same in California. In fact, I'd like to address the issues specifically that we've been talking about. I grew up in Arlington, Texas. I represent the 1st District of Oklahoma now. I went to college at Rice University down in Houston, Texas. And I'd like to address my question to Dr. Honeycutt. In your testimony, you wrote, quote, astonishingly, and every time I read testimony and the word astonishingly shows up, what comes next is critically important. Astonishingly, EPA's analysis, that's the EPA's own analysis, shows mortality increasing in certain cities, including Detroit and Houston, when decreasing the ozone standard from 75 parts per billion to 70 parts per billion. That is astonishing. Did that get taken into account? Are they, what they're suggesting is that it's worth maybe increasing mortality for these regulations? Can you address this for us?
Sure. That's called the NOx disbenefit. And if you look nationwide, there would be a net, according to EPA, a net decrease in mortality. But if you look at some specific cities, I looked at 12 in particular. Those 2 cities, lowering the standard would actually increase mortality. And it's because NOx both creates and destroys ozone. So what you're going to be doing is increasing ozone concentrations in the inner cities while decreasing it in the suburbs.
That is good information that we on the committee need to hear. Question for Mr. Sadredin. Maybe you could say that for us. Sorry.
Sadredin.
Sadredin. Thank you. How many different state implementation plans does San Joaquin Valley have in effect today?
As we speak today, we have 6 different state implementation plans for ozone and particulate matter, all with multiple milestones, redundant, duplicative timelines that we have to comply with. And as we speak today, we're in the process of writing another plan for the standard that was just replaced. And in the next 3 years, we have to write 4 additional state implementation plans for a total of 10 state implementation plans just for ozone and particulate matter.
And how difficult is it for your agency to keep up with these SIPs?
Yeah. You know, that's the least of the problems. You know, what the government inefficiency that this brings about, the staff work. The bigger concern that we have with this is the confusion that this brings to the public, to the business community that is subject to these redundant, duplicative regulations, and a tremendous number of lawsuits that each of these same deadlines, same targets that are established in 10 different vehicles create opportunities for attorneys. Of course, that's good job security for them, but good government, it is not good public education. It is not, and it is something that could easily be fixed, in our opinion. One of the suggestions that we are making in this 2015 Clean Air Act modernization that we're proposing is that when EPA establishes a new standard, for them to subsume all the standards into the new one, pick the most stringent requirements from the previous standards, give us a single set of timelines and deadlines to meet, to be able to educate the public, and also make sure we can enforce them effectively in a rapid fashion.
And I would just like to conclude by saying that we've heard folks suggest that certain local officials are in favor of more stringent national ambient air quality standards for ozone. Certain local officials are opposed to it. I can tell you from my state of Oklahoma, local officials are very opposed to it. I hope everybody understands that if the state of Oregon or the state of California, if other states want to have more stringent plans, that's not going to bother my constituents in the state of Oklahoma. They can go ahead and do those things without having to do it in Oklahoma. So I just want everybody to understand, when states become implementers of federal policy and then they end up getting bullied by the federal government, if you do this, then X, Y, or Z will happen. That's not the role of the federal government, to say that we're going to cut off your highway transportation funding if you don't comply with this new standard. This is federal bullying, and it needs to stop. And if Oregon or another state wants to implement more stringent standards, I'm okay with that. So with that, Mr. Chairman, I'll yield back.
Thank the gentleman for yielding back. Now recognize gentlewoman from California, Ms. Lofgren.
Thank you, Mr. Chairman. I'm pleased that we have a witness from California on today's panel, as our state has unique challenges when it comes to addressing air pollution. However, I think the changes to the Clean Air Act suggested by Mr. Sadredin's testimony would have the effect of delaying future efforts by EPA to protect health and the environment, and that's a position that is not supported by most Californians. In fact, I have a letter from the Coalition for Clean Air based in California that says, quote, "What will not help Californians to breathe easier is the proposal from the San Joaquin Valley Air Pollution Control District to weaken the Clean Air Act." And I also have a letter from the Central Valley Air Quality Coalition, which says, quote, "We learn more every day of the impacts of air pollution on our health, and our valley has become numb to the information because Mr. Sadredin and the Valley Air Board disregard it, blame external factors, and have failed to find a balance between supporting business and protecting public health," unquote. And lastly, I have an op-ed by 2 current members of the San Joaquin Valley Air District Board, Dr. Alexander Sheriffs and Dr. John Capitman, who write, quote, "We cannot support a policy direction which threatens to extend the time Valley residents are breathing unhealthful air. The district needs to focus on policy and advocacy to increase the tools and resources to meet more healthful air standards, not on how to delay attainment." And I'd like a unanimous consent to put these 3 documents in the record, Mr. Chairman. May I have unanimous consent, Mr. Chairman?
Without objection.
Thank you very much. You know, the Central Valley I chair the California Democratic delegation, and we have a diverse state, and the Central Valley is a key and important element of our state. It's much valued. It suffers from pollution that comes from the Bay Area where I live. It blows in on I-5 even from Asia, but also created in the valley itself, including significant volatile organic compound emissions from dairies and also oil and gas operations. And those things have created a problem in the valley. We have the highest asthma rate among children of any place in the United States right in our Central Valley, and it's a huge problem. Now, we can change the impact by technology. I come from Silicon Valley, and we know that if you have a problem, you don't have to suffer. You can set standards and meet those standards, and you can, for example, farmers have switched from diesel pumps to electric pumps. They've purchased cleaner burning tractors thanks to incentive programs. We have, along I-5, we're switching. We now have a very aggressive standard in the state for switching to alternative energy we're going to meet. You know, we have 1,000 premature deaths every year in the valley because of air pollution. And among all air pollutants contributing to cancer, diesel emissions is number one. So I think we have a great opportunity to promote even cleaner technologies and to create a cleaner environment for the people of the Central Valley, and most especially for the children. So here is my question for you, Dr. Craft. With so many children with asthma out in the Central Valley, what is the adverse physiological effects on kids with asthma from ozone pollution? And how can increased exposure to ozone impact the health of children? It costs the lost time because of health impacts out in the Central Valley is costing the valley $1 billion a year. I realize you're looking at just the health impacts, not the economy, but we are losing money in the valley because of these adverse health impacts. What can you talk to us about with these children and others with asthma?
Well, I'd like to say that children are especially vulnerable to the harms of air pollution, particularly those kids with asthma. And so it leads to increases in emergency room visits, missed school days, missed work days for parents. And it can also lead to permanent long-term damage. Actually, the Gouderman study looked and saw that air pollution in general showed that if air pollution is reduced, it leads to better lung health later in life. And so I think there's a lot of evidence supporting the fact that cleaner air is good for lungs of all ages, but especially for our most vulnerable, our kids.
Thank you. I'd just like to note that I think some of the objections from these outside groups that are running ads reminds me of the tobacco companies fighting control of tobacco, which caused lung cancer. And there's a lot of comments made about how regulations and control harm the economy. I'd just like to point out that California, that is embracing the green, looking for health, beat Texas in job growth by 30%.
Well, very good.
With
The
our
gentleman's
approach.
time has
I would
expired.
yield back.
Thank you. Mr. Sadredin and Dr. Honeycutt, your names were mentioned there for the last few minutes. Would either one of you care to respond to that?
Yes, thank you, Mr. Chairman. Just very quickly, I appreciate the good advice from the Congresswoman, and we always look to Bay Area, our neighbor, to do their part to help us with the pollution that they send our way. But make no mistake, although San Joaquin Valley is a conservative region in California, today we have put in place the most stringent regulations that you can imagine, to the point that Los Angeles now looks up to us in terms of what could be done. And by no means we're asking for delays in getting there. I urge you to take a look at the chart that I gave the committee in my testimony on page 5 that talks about how much reductions we have to make If you look at that chart, it breaks down emissions by various source categories of air pollution. The top part, where it says the stationary and area sources, that's all of valley businesses, oil production, farming operation. As you can see, even if we eliminated all of those sources, just simply said, move out of the valley, will come nowhere to meeting the standard. The bottom, the two lines that you see on the bottom are where we need to go to meet the standards. So I know industry cries wolf many times, and as a regulator, I've seen that over the years, but once in a while, that boy is right, that the wolf might be coming, and I think this is one of those cases. If you look at the numbers that I have here for you, we have to essentially eliminate all pollution sources in San Joaquin Valley to meet that. And just one final comment regarding the health impact and the cost. A lot of times people misrepresent these numbers by saying there's a healthcare cost that you're going to avoid for ozone. It's very minimal, and a big part, 90% plus portion of this cost is the life insurance value that they put on a premature death, which is questionable, but it's not a real contribution in or out of the economy that we're referring to.
Sure. Dr. Honeycutt, would you like to respond?
Sure. The Goddardman study that Dr. Craft just mentioned specifically said that ozone does not affect lung development. And I have it here if you want to read it. And the follow-up that they just released found the same thing, that ozone does not affect lung development. And I have both of those. I'd be happy to read you the conclusions if you like. And also, as far as asthmatics, the data is very clear. Asthmatics are no more sensitive to ozone than non-asthmatics are. And again, I have those studies here. I'd be happy to share them with you.
The chair now recognizes the gentleman from Georgia. Barry, you're up.
Thank you, Mr. Chairman. And also notice that every time Mr. Sadredin speaks, the alarm goes off like it's highlighting. We better listen to what he's saying. It's just some type of time.
Ozone levels must really be high when he speaks.
I appreciate the testimony here. It's very important issue because of the impact that it's going to have. And I've always been one that it takes in business and in everything else. You can only do so much, and then you have diminishing returns because you've gone too far. Mr. Holmstead, does the Clean Air Act allow for special treatment for places where air quality may be affected by emissions from other countries such as Mexico or China, or even in other areas of a state or region? My understanding from the testimony I've heard and what I've read is that we're not giving an account for pollution that may be created in another area and move into an area that would cause the receiving area to be a non-attainment. Is there an exemption? Is there allowance for those?
I'm sorry to have to say it's complicated.
Okay.
In theory, some of those things can be excused. In practice, EPA has never really allowed that. And one of the things you're hearing about is this exceptional events policy. It's been almost impossible for anyone to, I mean, it takes hundreds of thousands of dollars and years to try to get EPA to excuse one exceptional event. The other thing I would point out, though, is the Clean Air Act itself, and that's why we're talking about these levels. What we really should be talking about is the implications of the standard. Everybody agrees that we ought to be improving air pollution, but the way the standard setting works with all the other regulations just doesn't make any sense anymore. And right now, the Clean Air Act specifically says that certain weather events, the things that cause high episodes of ozone, cannot be excused. It says meteorological inversions and stagnant air. Those are events that are completely outside the control of any state, and yet you're held accountable for those things under the Clean Air Act. That's just one of the things that just ought to be changed.
Well, it's interesting you bring that up because I'm looking at a map here, which, Mr. Chairman, I'd like to submit for the record, which is the impact area on the state of Georgia that the new standards would have as far as the areas that would be out of attainment at this point. And I also have a letter from our governor of our state, the Honorable Nathan Deal, who also served in this body at one time, who says that in these areas it would be impossible for us to reach attainment. because of the way the standards are written. And I'll also point out that the area that is highlighted here that would be in non-attainment is not only the economic center of the state of Georgia, but the entire southeast. So what is the cost that we could see in an area that is so important? You're talking about one of the largest airports in the nation. Atlanta Hartsfield Airport is in this area. One of the largest power plants in the southeast is in this area. What type of economic impact or hidden cost would we expect to see with the implementation of this standard? Mr. Homestead.
The only thing we know is for sure is that the cost of everything will go up, right? Because energy is embedded in everything we do. So you're going to be paying more for lots of different things. The thing that's really hard to judge, and people have said it's certainly true that we've had economic growth even with tighter standards. But that doesn't mean that this next increment isn't going to be enormously expensive. So maybe you can continue to have economic growth there, but it will be much less than it would otherwise be, in part because you're making it very difficult for businesses to expand in that area. They just have nowhere to go.
Dr. Honeycutt, let me read a portion of this letter, and maybe you can respond to the same question. Our governor says these rules are in addition to the fuel economy standards and the Tier 3 tailpipe emission standards for cars and trucks implemented by the federal level, which increase costs for business and consumers in my state and others. This is after he's gone through a litany of other EPA regulations that have affected our area. All of these regulations have required substantial investment on the part of Georgia companies and consumers and constitute a moving target for Georgia companies. The moving target is one of those areas that I hear a lot about with federal regulations, that they are unattainable. Could you and Mr. Sadredin comment on that?
Yes, sir. He's absolutely right. EPA needs to provide the states guidance as soon as they put a rule out, not years later as they have in the past, because their deadlines are flexible, ours are not.
Mr. Sadredin?
You know, it was mentioned earlier that Congress was very clear about not including economic cost and setting standards. The fact of the matter is, if you actually read the Supreme Court case, it said Congress failed to give any guidance on that. Therefore, absent guidance from Congress, judges, bureaucrats such as myself and my colleagues at EPA have become policymakers, and they have come up with a scenario where they say, don't worry about the cost effectiveness or economic feasibility when we set the standard during the implementation. We'll take care of that. And unfortunately, the Clean Air Act, as written right now, does not give them the flexibility and the latitude that they need with those very fixed timelines, deadlines that you have to come into attainment to actually be able to do what they claim the Clean Air Act allows them to do, to incorporate economic feasibility during the implementation phase.
Thank you. Mr. Chairman, I move to have both of these documents submitted to the official record.
Without objection.
And I yield back.
Gentleman yields back. Now the gentleman in Colorado has 5 minutes to see if he can make Mr. Sadredin make the alarms go off.
Thank you, Mr. Chairman. Just a couple things I'd like to introduce into the record, if I could. First is an article published in the Durango Herald supporting the decrease from 75 parts to 70 parts, dated October 5th, 2015. If I could introduce that into the record, sir.
Without objection.
Second thing is a little more cumbersome. That's just 1.5 pages. This is 1,251 pages, which is the compilation, Dr. Honeycutt, of all the studies, some 2,300, undertaken and reviewed by the EPA in preparation for the reduction in these ozone numbers. And so I'd like to introduce the 1,251 pages, which compiles the 2,300 studies for the record.
I will allow that if you'll start reading them without objection.
Well, I will. Okay, so Martin, RV, Fiore, AM, Von Dockelar, Space Diagnosis of Surface Ozone Sensitivity to Anthropogenic Emissions.
They will be admitted, Mr.
Right.
Perlmutter.
I guess, and then I'm going to yield to Mr. Byer, and I just say to the folks on the panel, you know, in the Denver area, we've had ozone issues for years and years and years. And our state prides itself on being very outdoorsy, you know, wanting to get outside, take advantage of, you know, beautiful climate that we have. But our air is always something that has been difficult. And because we do have some of the things that you mentioned in your testimony, you know, we're in a pocket where the weather, you know, creates inversions and things like that. But each year and each time, industry complains that this is going to be unattainable. We can't do it. But then over a course of time, they do. And it's improved the health of Coloradans. And we've got to continue to improve that. Our states continue to grow, and we have a substantial oil and gas industry. And so, as hard as these things are, the economy of Colorado has flourished because people want to come there for a great environment. And part of that is cleaning up our air as best we can from time to time. And so I appreciate the testimony of everybody. I understand this is hard and it can be expensive, but the rewards are substantial as well. And that's not been so clear today, but in Colorado, we've experienced that success and we've experienced that growth, and the health of the population has been improved, I think, over the years, you know, from growing up as a kid and having the brown cloud. It's improved a lot, and I yield to my friend from Virginia, Mr. Byer.
Thank you, my good friend, distinguished colleagues from Colorado. I was confused by Dr. Honeycutt's comment on Houston and Detroit. The excellent Democratic staff at the Science Committee dug out a Texas Tribune article that says that paradoxically lowering levels of nitrogen oxide, parens, a pollutant that contributes to forming ozone, end paren, can temporarily increase ozone levels because NOx also helps dissipate fully formed ozone. That's why EPA predicts a slight increase in premature deaths if ozone standards are lowered. But Dr. Craft, can you please elaborate on this phenomenon? Is this a reason to not implement these new lower standards?
No, it's not. It's actually a simulation that's done, and that simulation was done looking specifically at NOx reductions. It did not include reducing some of the other precursors that form ozone, including VOCs. And so when a region has to put together a plan to reduce ozone, what they do is they identify an optimized plan to reduce both NOx and VOCs. And so the idea of NOx scavenging can be addressed through the way that you implement the new standard.
Excellent, great. And one more quick thought within our 25 seconds. You know, they talk about how, gosh, even the national parks can't get to these ozone standards because of background ozone levels. How high are background ozone levels? Has Dr. McCabe's comment that the EPA will work around that? And does the ozone in the parks come from the parks, or is it blown in from somewhere else?
Well, there aren't a lot of power plants or a ton of mobile sources in the national parks. Most of that is actually coming from sources that are downwind of those national parks. And so addressing those sources will help the areas where we have national parks that are having an occasional exceedance back into attainment.
Thank you very much, Mr. Chair.
Dr. Honeycutt, you've been mentioned a couple of times now in the 1,200-page study that Congressman Perlmutter refused to read. And here with the article in the Texas Tribune, would you like to take time to respond?
Sure. Thank you. Yeah, I've actually read the human health portions of that document. I didn't read the atmospheric chemistry portions or the welfare portions, but I did read the human health portions. Yeah, as far as the NOx disbenefit, if you believe that ozone causes premature mortality, which EPA does, then you have to accept the disbenefit along with the benefit. Because if you believe ozone causes premature mortality, then you will see it if you lower NOx around highways. So there's no getting around it. There's no doubling down to hurry up and get the emissions because you'll just hasten the deaths then. So, and as far as asthma again. The question is not, does ozone exacerbate asthma? The question is, will lowering the standard from 75 down to 70 or even 60 reduce the number of asthma exacerbations? And according to EPA, the answer is no.
Okay, thank you. And the chair now recognizes the gentleman from Illinois, Mr. LaHood.
Thank you, Mr. Chairman, and thank the panelists here today. I guess in looking at my home state of Illinois and looking at the impact that this proposed rule would have on jobs and economic growth, I have real concerns about that. And I want to cite a recent analysis and study done by NERA Economic Consulting that is titled, What Could New Ozone Regulations Cost Illinois? And this is dated August of 2015. In looking at the proposed rule and the effect it would have in Illinois specifically, $47 billion in gross state product loss between 2017 and 2040. 35,000 lost jobs or job equivalents per year. $12 billion in total compliance costs. $650 drop in average household consumption per year. $1 billion more for residents to own and operate their vehicles statewide in this period, and I will submit this for the record. And I guess looking at that and a number of other studies that look at what this would do, what causes concern for me is I look at companies, particularly in my district in central and west central Illinois. Caterpillar's based in my district, a Fortune 40 company, very benevolent, generous company, but also has been very proactive in the environmental movement and what they've done at their companies. Company like John Deere, ADM, that's in my district. And I look at how they are trying to compete worldwide in the marketplace, and they are trying to obviously create jobs and opportunities. And when I look at this proposed rule, what that would do locally to those companies, and I guess I couple that with, when you look at the statistics, air quality in American cities is the best that it's been in a century. Ozone pollution has declined 33% since 1980, 9% since 2008. And so when I look at those companies and what they're trying to do proactively, and then they have to look at this coming down on top of them, I guess, Mr. Holmstead, in looking at that, competing in the world marketplace, and whether you're going to create jobs in Illinois or you're going to go to India or China or someplace else, can you talk about that a little bit?
There's one observation I like to make. Certainly, California has done very well economically over the last number of years. There was a time when we used to manufacture things in California. We don't do that anymore. It's just too expensive because heavy manufacturing requires energy. And so that's been to the benefit of other states. We're getting to the point now where if we turn the rest of the country into California, we will have no choice but to export those jobs. And it's not because companies are bad citizens, but if they compete economically with everybody else in the globe, and all of a sudden you drive up their cost too much, the same thing that happened to Southern California is going to happen to Central Illinois. And I just think that we just need to be smart in how we continue to make environmental progress. That's we can continue to make progress, but we can do it in a way that's much more reasonable, that is not going to disadvantage U.S. businesses and consumers.
And it would be fair to say, Mr. Holmstead, there's a direct correlation between what this rule is going to do and job loss or economic loss with companies like I mentioned and others.
There is no doubt that this will hurt the rate of economic growth. I think it's hard to know, and I have a great respect for NERA. I think that study looked at even a lower standard, and so that probably overstates the cost. But there's no doubt that it will impose additional costs on businesses. It will make it harder for them to grow and expand. And ultimately, you're going to drive people out of these areas, and they're going to have no choice but to go somewhere else.
Thank you. Dr. Honeycutt, I wanted to ask you, in terms of the effect this will have on state and local resources, you know, when these EPA if this rule is implemented, in terms of agencies catching up on implementing the current standard when they're already working on a standard now. Can you talk a little bit about that?
Sure, it is substantial. It costs TCEQ, we've put money to the numbers, $1 million to do a SIP for a moderate area. And so and that's just the SIP. That's not even looking at the exceptional events, the long-range transport things. Those are hundreds of thousands of dollars. So, and that's tax money. So yeah, it's substantial.
Thank you. Mr. Chairman, if I could, I'd like to submit the study I just referenced and also a letter from the Tri-County Regional Planning Commission in Peoria, Illinois, asking for a delay in the attainment designation.
Approved without objection.
Thank you.
I will assume the chair for the time being and begin my questions. And my first question is to Dr. Honeycutt. The EPA admits that much of the control technology to comply with these new standards does not yet exist. I think the latest estimate is only about 40% of the emission reductions can be attained with the current control technology. Can you give me some idea how Texas plans to comply with this if we're dealing with basically a black box?
I wish we knew. Most of the sources out there are vehicle emissions or non-road emissions. So we're going to do something with those, and we're really not quite sure what yet. This is uncharted territory for not only Texas, but for most of the country.
Well, I think the answer is going to be that you will shut down whatever industry is producing these ozone emissions that prevent you from meeting these reduction standards. So if you don't have the control technology to install, and I used to work earlier in my career, worked for Combustion Engineering in their Environmental Systems Division, so I have a pretty good idea of what it costs to design, build, and install this equipment. You can't design, build, and install stuff that doesn't yet exist, so the only option is to shut down whatever's producing the emission. So would you concur with that?
I think at this point in time, everything is on the table.
Okay. In regard to these issues of air quality, and I pointed out in this hearing before that since 1980, our GDP's gone up 467%, vehicle miles have gone up 94%, population's increased 38%, energy output's gone up 32%, yet emissions have gone down 50%. The air is demonstrably cleaner than it's ever been. Our economy is continuing to grow. I think when we talk about the balance between health and economic growth, one of the interesting things, and asthma has been mentioned several times here, is that there's peer-reviewed studies out from the medical community, including UCLA, that indicates that even though air quality is dramatically improved, asthma rates have spiked, and it's, and particularly in California, the UCLA study, Mr. Sadredin, that the single biggest predictor is low income.
Right, Mr. Chairman, people often misstate the impact of air pollution on asthma, claiming that air pollution actually causes asthma. That is scientifically, there's little evidence of that in science. We're talking about exacerbation, and if you look at cases of asthma in some of the more pristine areas on the coast in California, asthma rates are going up at a much higher rate compared to Los Angeles and Central Valley, where air pollution is higher. So the relationship is not there, but it's something that tugs at your heart when you talk about children with asthma, and that's a good bumper sticker sort of a justification for the enormity of the Clean Air Act that we're talking about. In San Joaquin Valley, we have reduced pollution by over 80% over the last 20 years. We've imposed the toughest regulations you can imagine on farming operations, agriculture, dairies. Unfortunately, some of my colleagues from urban areas, they think food just shows up on the grocery shelf somehow magically, and they don't really understand all the work that has to go into producing it. We're at a point in our region with double-digit unemployment and low level of education with a large portion of our Hispanic population. It is very difficult to envision a scenario where we can meet this new standard without having to actually shut down businesses, as you mentioned. And that's the point I wanted to get into. Congressman Lofgren introduced a letter from Central Valley Air Quality Coalition earlier saying that everybody's okay in California with this. This same group had actually recommended to our agency that we have no farm days, no construction days, no drive days. And we're not talking about a day or two here and there. We're talking about 100 days a year during summer having no commercial activity, and they thought that's something that's reasonable.
Dr. Honeycutt, if you'd like to respond in the time that I have remaining, but I would like to, the NARA study was mentioned earlier. Those numbers have been adjusted to reflect the new standard that the EPA is requiring, and it is a devastating impact on the economy, if you'd like to respond.
Sure, just real quickly, as far as asthma causation, Gina McCarthy testified in July of this year in front of this committee that ozone does not cause asthma, as did a minority witness earlier. However, EPA says that it is likely causal, that ozone likely does cause asthma, which is the same designation they give to premature mortality, total premature mortality, and which the benefits are based on. So that's why there's some confusion, is because EPA says one thing and Gina McCarthy said another thing.
Thank you. My time has expired. I would now like to recognize the gentleman from Arkansas, Mr. Westerman.
Thank you, Mr. Chairman. Let's see, Dr. Craft, you work for an organization that's very concerned about protecting the environment, making sure we have clean air quality. And on the concept of diminishing returns, do you think we ever get to a point where we're trying to achieve something that the cost to achieve it is more than it's worth achieving, or should we just make improving air quality the ultimate goal at any cost?
Well, Environmental Defense Fund uses market-based principles as a foundation for our work. So we've worked successfully with the oil and gas industry, for example, to implement control technologies on equipment that saves money and also reduces the amount of pollution in the air. Getting to the question of diminishing returns, I don't think we're anywhere near where we need to be in terms of reducing the amount of pollution. The question of, how is Texas going to comply? Well, we have VOC emissions in Houston that, through studies funded by TCEQ, show that those emissions are underestimated by a factor of 5 to 10. So looking at reduction of upset events, looking at the 1 billion.
I'm from Arkansas, I'm not from Texas, so I need to move on here. It says here in your testimony that to reduce harmful air pollution such as ozone from pollution hotspot areas. Have you ever been to Arkansas?
Yes, I have. We work closely with Walmart, and so we have an office in Bentonville. I've been there several times.
Okay, so I was there last week in my district, which happens to have about 18,000 square miles of forest. To put that in perspective, just the forest in my district are about 264 times larger than Washington, D.C. And I like to get out in my district in the forest and breathe the fresh air. Actually, I think the air quality is much better there than it is here, but if you look at the ozone monitors, it's really not that much different than the air quality here in Washington, D.C. And actually, if you look at some of the information from the EPA, it talks about trees creating a lot of ozone through their VOC emissions. So, should we go cut down all the trees in my district so we can improve air quality?
Well, actually, it's funny that you mentioned that. We're actually looking into trees as an intervention strategy for places like Houston. So there is evidence that some species of trees release VOCs, but not all species.
So maybe we should just plant plantations of monocrops in Houston to fix the air quality down there. I'm trained in forestry, so that would be kind of interesting if we started doing stuff like that. Moving along, Mr. Holmstead, are you familiar with EPA's claim that the proposed ozone standard will only impact 9 counties?
Yes, that's just silly. They first of all assume all kinds of things and run their models and say, look, there's only going to be 9 counties that don't attain the standard. The problem, that's not the way the Clean Air Act works. It's not only counties where there might be a monitor, it's everywhere else where EPA predicts using models that you're going to have an area that violates the standard. So that actually really makes me angry. EPA should be at least honest about the implications of this, because it's going to affect many, many more parts of the country.
So it's very dishonest of them not to include non-monitored counties, because we know the air mixes, and you got these autogenic effects. What about using the year 2025? Is that dishonest as well?
Well, yeah, because all of these regulatory consequences happen now. The permitting problems happen now. All the other regulations happen now. If the Clean Air Act said, great, if EPA says that everyone's going to come into attainment within 10 years, if that's the way it worked, that would be great. But we don't wait around. You impose all these obligations now, regardless of what EPA projects for 2025.
Yeah, so can you explain quickly the actual impact of the ozone rule for those of us not inclined to use EPA's fuzzy math or their fuzzy logic or whatever it is they use? Maybe we need to pump some of that clean air from Arkansas over into the EPA building.
Just very quickly, it will be very hard to expand new businesses in many rural parts of the country. That's the most kind of the thing people don't understand. This is what this affects is rural parts of the country would like to attract new business. That is going to be difficult or impossible. And then in other areas, you just drive up the costs even more, and you do so unnecessarily. There's just a better way to clean the air, but unfortunately, we've become so dug into this statute that was created 45 years ago that just doesn't really work anymore for the way that the world works today.
So you just cut down all the trees in my district and we could meet the air quality.
Well, at some point afterwards, I'll tell you a story about VOC emissions and trees. It's actually kind of sad to see what EPA has done in the past about that issue, but we don't have time to talk about it here.
Thank you, Mr. Chairman.
Gentleman's time has expired, but I do want to comment on the gentleman's line of questions and the responses that apparently the EPA has now gotten into the business of determining that there are some good trees and some bad trees, and maybe the solution is just clear cutting. I hope not. The chair now recognizes Dr. Abraham, the gentleman from Louisiana.
Thank you, Mr. Chairman. I'm going to just hit this from the medical perspective. The tone and the verbiage from EPA has changed over the past several months to this theme of childhood asthma. Gina McCarthy touts it, everybody in the EPA touts it, and this is what they're trying to sell, that the ozone is causing this exacerbation. Again, I am limited in my practice as to I have to do what we call standard of care, and we have to do things based on only evidence-based scientific data. And I usually go to the CDC for my talking points and when I'm trying to determine what's best for my clientele. I've practiced medicine all my life, and I've practiced it in places all over the world. And I look at CDC charts and maps, and I see where there are the lowest emission standard, there's the highest asthma, and Gary, goes back to your statement of socioeconomic factors being a major cause of exacerbation of asthma, and I can tell you from a practitioner's point, that's very true. I look at some of these other studies from these nonprofits, and the first thing that we as physicians and any scientist is taught is to look at who's funding the study. because of the conflict of interest possibility. Where are you getting your money? And Dr. Craft, and when the Congresswoman asked you a question about ozone and the possible developmental lung function, I noticed that you didn't use the word ozone. You immediately shifted to air pollutants to answer that question. So, Dr. Honeycutt, I will start with you. I am concerned that we are seeing a lot of bias and conflict of interest in this, in our scientific advisory boards, especially the Clean Act Scientific Board. What can we do to combat that? How can we tell our constituents and our patients that what we are being told by EPA, by everyone, are actually based on facts and just not theory, and not being pushed by specific interest groups that want to sell a product?
By the way, I was born and raised in your district, and you represent my parents, so.
Hey, I didn't know that.
The CASAC is appointed by EPA. Whenever we do a board like that, we have an external party to vet people and pick them for us. And the panels need to be balanced in as far as...
Are they now balanced, in your opinion?
No, actually not.
Nor in mine. I will agree with your statement. Go ahead. I'm sorry.
Oh, they need to be balanced in terms of bias and who they represent. And right now, they're not.
Okay. And I think you've answered the question, but I'll ask you to answer it again. Will lowering the ozone standards from 70 to 60 do anything for asthma?
According to EPA, no.
And I've seen those studies too. And is there any evidence, and any panel member can answer this, that ozone, specifically ozone, exacerbates asthma? Dr. Craft.
Yes, I'd like to comment and I guess give the reason for why I didn't mention ozone specifically with the Gauderman study. Ozone actually didn't decline that much over the time period that the Gauderman study focused on, so that's why I discuss air pollution in general. Get to your question
But you
about...
understand, Dr. Craft, that was not the question she asked. I was just referencing the question, the specific question, and I was just looking for a specific answer. And I just didn't see that, and that's the reason I brought that up.
Right. So to give an example of a study that you requested, I'll refer to, again, testimony of Dr. Wallenius, who mentioned a 2010 study by scientists at Emory and Georgia Tech looking at a 30% increase.
And may I ask who financed that study? Do you know who financed that study?
I'm not sure who financed
Okay, and
that
see,
study.
that's, I guess, my point. Like the gentleman from Colorado, he had a 2,200-page study, and there are millions of studies, but I want to know who's got skin in the game as to how that study is going to be presented. So that's all I'll say. I'm out of time, and I appreciate the panel being here. Mr. Chairman, I yield back.
Thank you, Dr. Abraham. I thank the witnesses for their testimony and the members for their questions. The record will remain open for 2 weeks for additional written comments and written questions from members. This hearing is adjourned.